steps you should follow to start using the UGEO PT60A are very simple. Simply switch on the machine, enter the patient data, and select your probe. Now, you may start scanning, and you can very easily change the depth of the scanning area. You can also adjust the image quality or the resolution by following very simple steps. I will show you how to use these 5 shortcut keys on this system. The first key is for entering the patient data. By pressing the second key, you can select your transducer, such as the 5 to 12 MHz and 6 to 15 MHz linear transducer or the 2 to 5 MHz convex. Next, you can select the application of your scan, such as anesthesia, musculoskeletal, vascular, or small parts. By pressing again on this transducer key, the selection options are gone from the screen. The third key is for Quick Scan, which allows for quick optimization of settings for your scan. While you're scanning, you can save images or scenes by simply pressing this fourth save key. You can also freeze and unfreeze your image by pressing this last freeze key.
My name is Dr. Mohammed Abdulmanem. I'm a consultant anesthesiologist and a professor of anesthesiology in charge of University Hospital. I want to introduce you a new feature in Samsung medicine UGEO PT60A, which is needle mate. Before we used to angulate the probe just to see the tip of the needle and the shaft of the needle completely. Now with needle mate in UGEO PT60A, you don't need to move the probe anyway to the right or to the left, but if you use the software, you can easily see the shaft and the tip of the needle, which gives you an option to move the waves coming out of the probe 5 to 10 degrees to the right or 5 to 10 degrees to the left, so you can clearly see the shaft and the needle tip with this machine. As you can see on the screen, here the needle tip is very clear and the whole shaft of the needle is very clear to be seen. Insertion of needle requires clear visualization of the needle tip and shaft prior to injection of local anesthetic. With this machine, ultrasound machine UGEO PT60A, you can use a needle mate, which is 5 to 10 degrees steering of the rays coming out of the ultrasound probe to the right and 5 to 10 degrees to the left. That's maximum needed to make it clear enough to see the needle.
The sciatic nerve anterior to the gluteus maximus muscle is found just lateral to the origin of the biceps femoris muscle at the ischial tuberosity. The nerve lies within a palpable groove in this location and is more superficial than in the gluteal region. This is an ultrasound image of the subgluteal sciatic nerve. Position the patient in the semi-prone position with the block limb uppermost. Mark the greater trochanter, GT, laterally, and the ischial tuberosity, IT, medially. The midpoint marks the approximate sciatic nerve location. After preparing the skin and the transducer, place a 2 to 5 MHz curved transducer over the subgluteal region in a transverse plane to image the sciatic nerve. Needle insertion approach. The sciatic nerve may be difficult to visualize in this region because of the required depth of beam penetration and the use of a lower frequency transducer. In plane, IP, and out of plane, OOP approaches are possible for this, and the OOP approach is commonly used for catheter placement. In-plane approach. Depending on the depth, use a 5 or 8 cm 22 gauge insulated needle and advance the needle in line with the ultrasound transducer. When the needle makes contact with the nerve as indicated by nerve movement, stimulate the nerve electrically to confirm needle proximity and check the nature of nerve stimulation.